August 1st is World Lung Cancer Day. While lung cancer remains the leading cause of cancer deaths, according to the American Lung Association, survival rates are improving. Here to talk about this is Dr. Matthew Gaudet, a thoracic surgeon with Cardiothoracic and Vascular Surgeons of Texas. You treat patients at St. David's, North Austin. Thank you so much for joining us.
Thank you. Good evening.
So the State of Lung Cancer 2023 report shows the survival rate increasing by 22% in the last 5 years. Dr. Gaudet, what is the reason for this?
I think the biggest thing is that we're starting to detect lung cancers earlier. Lung cancer screening is becoming more mainstream. It was approved, just over 10 years ago for patients who have a smoking history and are considered high risk for developing lung cancer. So we're able to find those lung nodules and lung cancers earlier and treat them as such. And we've also had major advancements in the systemic therapy with immunotherapy and targeted therapy as well to treat these systemically.
Now, I know most cases are found in people who smoke or have smoked, but who else is at risk? And what can people do to improve their chances of surviving lung cancer?
People who've been exposed to secondhand smoke are at high risk as well, even though that's something that's a little more difficult to quantify than actively smoking. Environmental and occupational exposures to chemicals and things such as radon also increase patients' risk. What they can do to improve their survival is just be aware of these things, be honest, and when they're meeting with their primary care doctor to discuss preventative health care and screening, just bring these things up and discuss them so that they can be screened appropriately.
When it comes to treatment, how has it evolved over the years for lung cancer specifically?
Well, as a surgeon, I'll gravitate to the surgical management. We use minimally invasive techniques to do these lung resections now. We use the surgical robot. St. David's, North Austin has the newest model that we've gotten just in the last few months. The impact of surgery in terms of recovery is shortened. Pain scores are much improved. We also have advanced diagnostic capacity at St. David's, North Austin, including a robotic bronchoscope, which allows us to biopsy nodules that are small and peripheral, which otherwise would have been very difficult.
Let's go back to screening, because that's where, the early detection is so important. When and how often should people get screened for lung cancer? What does that entail?
So what it entails really is the primary care doctors do most of the screening. So as part of their intake and annual physical, talk about their smoking history. Patients between the ages of 50 and 80 who have a 20-pack year smoking history, which is on average 1 pack per day for 20 years, who are either currently smoking or have quit within the past 15 years. Those are the patients who the U.S. Preventative Services Task Force has identified as high risk and qualifying for lung cancer screening. And it just consists of a very quick, simple CT scan that is done with a low dose of radiation, 1/5 of the dose of radiation of an average chest CT scan, and probably takes about 90 seconds to complete.
And could potentially save your life.
100%. The lung nodules that are found on screening, the screening process has decreased or improved the survival rate of lung cancers by over 20%.
All right. Dr. Matthew Gaudet, thank you so much for sharing your time and your expertise with us tonight.
Thank you.